Even though cannibalism is common between insects, snails, fish, or amphibians, it is extremely uncommon in mammals and is often triggered by stressful situations. Similar to mammals, there are a lot of negative side effects from human cannibalism. One dangerous side effect of cannibalism are prion diseases. An example of prion disease is the Kuru disease. It was discovered in the Fort people, a tribal group native to Papua New Guinea. Kuru disease was first identified when Australian gold prospectors looked for gold but found a tribe and the Kuru disease instead. It was discovered and identified by Dr. D. Carlton Gajduzek in the early 1950s. Kuru disease caused people to lose control of their emotions, physical movement, and bodily functions, causing them to die, since there is no cure. But what are prions?
Prions. Prions are versions of normal proteins with their shape altered, losing their original function and becoming infectious. These dysfunctional proteins can influence other healthy proteins to change, causing the disease to spread. Prions essentially create holes in the brain, giving it a sponge-form appearance and causing death. Because of this characteristic, all prion diseases, including Kuru disease, are fatal. Prions can be present in any nervous system, including organs and muscles, but they are most common in the brain and spinal cord. So if you eat the brain, you have the highest risk of getting Kuru disease. Prions are proteins, but they cannot be cured by radiation or heat. This means that cooking the meat infected with prions will not get rid of them, and additionally, there is no cure, so radiation treatment used against cancer will also not treat this form of infectious protein. Kuru disease is similar to mad cow disease because both prion diseases involve eating infectious meat. However, one comes from a cow's meat and the other comes from cannibalism. So you eat cow's meat with prions, you get mad cow, and if you eat human meat with prions, you get Kuru
The
disease.
disease results from ritualistic cannibalism during funeral feasts, which is consuming the highly infectious brain tissue of deceased tribe members. When investigated, Kuru disease was found primarily in women and children. Women prepared the corpses and interacted with the infected brain. Since they didn't perform modern sanitation practices, such as washing their hands before eating, they were infected with the disease when they ate. Additionally, women and children commonly consume the brain, which is known to be the riskiest area to consume. Fewer men were infected because they weren't involved in handling the corpse, and typically they avoided eating the brain.
Because of this discovery, cannibalism was banned by the Australian administration, and their findings were communicated to the tribes, causing the practice to decrease in the 1960s. Currently, the four people have stopped mortuary feasts for over 50 years, but some cases of Kuru disease continue to surface because the prions could take decades to show their effects.